Welcome everyone to a brand new lecture with Cosmetic Laser Dermatology. Today we are here to learn about the power of technology in aesthetics. And Dr. Wu is an esteemed expert in this area, and he's going to give us all a breakdown on lasers and RF microneedling and all the different devices that are out there and help us understand what's available, how it works, what it does, and what laser might be the best for you. After this, we are live. It is here in San Diego. So we will have time for Q&A at the end. So if you have any questions, feel free to pop them in and we'll get to as many as we can at the end. And otherwise, Dr. Wu, I can give you a little introduction if you don't know him, but he is a board certified dermatologist and with practicing in San Diego. And he also has a practice up in Vancouver, Canada. Dr. Wu is does all sorts of cosmetic procedures. So today he's speaking about lasers, but he also does a lot of injectables and body sculpting and all types of aesthetic work, as does all of the other providers at Cosmetic Laser Dermatology. So we are very excited, Dr. Wu, and take it away.
Thanks, Risa. And thank you all for joining us this evening. The talk today is basically an overview of all of the different technologies that we have in the field nowadays. The field is advancing very quickly, and technology is playing a huge role in our field, as well as, of course, in every field. But sometimes when it gets a little bit overwhelming, when there's so many different options and different names and different brands out there. So we thought it might be a good idea to just kind of summarize what's actually available and kind of give a brief description of it so that we have something to go off of. So let's kind of dive into this. This slideshow is really going to be about energy-based devices, and that would include things like lasers and lights and ultrasounds and radio frequencies. And that's, I think, a good way to kind of approach this sort of topic. We'll go briefly into what's available and then kind of how they work and then what they do, so that at least we can get some familiarity with these types of things. So what's available? Well, I think we can kind of break things down from an energy-based device point of view in aesthetic dermatology into these four major sort of categories. Because as dermatologists, what we use to treat the skin are, number one, visible light devices. Okay, so these are like blue lights, red lights, yellow lights, anything that basically is a visible light. We can sometimes use in the correct situation. The second thing is laser. Okay, and I'll explain the difference between a laser and a light, because there's significant difference between the two, and that kind of governs how they end up being used. The third sort of category is radio frequency. It's a different type of energy that's not light based, but rather radio frequency. And then finally, there's ultrasounds. And these four categories, I suppose, would make up kind of the majority of energy-based devices that are currently available. So what's visible light? Well, it turns out that the so-called electromagnetic spectrum is very vast and broad. And what we perceive as visible light is really only a fraction of the total radiation that's going on. As this picture sort of illustrates, the visible light spectrum is somewhere in between 400 to 700 nanometers, and it comprises violet up to red, basically. But beyond red and shorter than violet, there's ultraviolet, infrared, and then et cetera from there. Visible light, though, can be leveraged by aesthetic providers to sort of treat the skin in many ways. And what we can think about when we talk about sort of light sources is, are they kind of low energy light sources, right? LED lights, for example, and there are some that are just commercially available for home treatment, and there's some that you need to use in the office, or are they kind of high energy light sources, the main one being so-called intense pulsed light. Okay, and so LED light therapy, sort of at home with masks and devices that you can purchase, has actually become quite popular in the last few years, partly because some of the science has started to catch up with the thinking, and so nowadays actually some of even these home use devices can have some benefit in terms of rejuvenation, mild rejuvenation, but still some benefit there. And then for wound healing and for acne and things like that. And the problem with these sort of devices is that there's a lot of them on the market, and the effects are really dependent on the specific range of wavelengths that they produce, as well as the specific sort of energy levels that they produce. And there's no real regulation regarding that. And so it's still a bit of a hit and miss if you were to sort of just pick one up off the shelf, whether or not it's actually going to work like these studies can suggest that they can work. And it would take a little bit of deep diving into exactly the specifications of each individual device in order to make the best decision. But still, it's something that can, in the right situation, be a convenient way to boost an overall cosmetic regimen if you've got a little home device that has some efficacy to it. In office, we also offer LED light therapy, and the office devices typically are much more powerful than the ones that are available for home use. And that's why they have to be used in the office. But their principal action is very similar. It's these low level light energies that essentially interact with some of the skin components and cause improvements in certain ways. And so this is a typical one. If anyone in the audience has been to our office and maybe undergone something called photodynamic therapy, then this blue light is part of that process. And you can also see this type of blue light offered in clinics for acne treatment, and sometimes also for wound healing as well. On the other hand, there's really high-powered light sources, okay? And these are what we call intense pulsed light. And instead of just emitting, regular visible light, these devices use a very high-powered xenon flash lamp that is extremely bright. And it emits essentially a broad spectrum of wavelengths, anywhere from 400 to 1200 nanometers. And the way we sort of target or tailor these types of energies and treatments is to use so-called filters. And the filters narrow down the spectrum of energy that is being emitted by the device. And that's very important when we want to achieve certain specific goals with these technologies. But IPL is something that's tried and true. We've been using it for decades, and there's many different IPLs available. But in general, they tend to be very good options for treatment of mild sun damage, brown spots, reddish discoloration, evening out skin tone, even improving a little bit of skin texture, pore size, and fine lines. It's just a very nice way to go about doing it because they tend to be quite gentle, usually not a whole lot of downtime. So therefore you can kind of fit them into your life without too much disturbance. And so, for example, especially for fair-skinned individuals, the IPL can be a really useful tool because after a few simple treatments, we can get pretty noticeable improvements in skin quality. For example, this individual here had 2 treatments with an IPL, and some of the existing sun damage in the form of like sunspots, brown spots, discoloration has dramatically improved. And just the overall skin tone looks a little bit softer. Just turning the clock back a little bit. It's very safe and very tolerable sort of treatment. So that's one very common use that we see, because sunspots are probably one of the most common things that present to our eyes. And then the other thing that is very common is kind of redness of the skin, whether it just be from a little bit of normal but excessive redness all the way up to known conditions like rosacea and other sorts of flushing type dermatology conditions. The IPL is actually a very versatile tool for this type of problem too. And this individual also had, I think, 2 treatments and was able to, get that redness under control. It can be sometimes very challenging to correct really recalcitrant redness of the skin. And the IPL is one of the few tools that can really consistently do so. So that's all just from simple light source, basically. We're not even talking about laser quite yet. It's just lights of different energy levels and used and applied in different ways. So really useful tool. and a great place often to start in an aesthetic journey, if you will. Now, lights and lasers are different. Although they're both in the electromagnetic spectrum, and they can both be of a similar sort of range of wavelengths, the key difference between a light and a laser is that a laser only emits a single wavelength. Okay, and so what that means is that, for example, red light is somewhere in the range of 600, 20 to 640 nanometers or so. That entire spectrum is essentially viewed as kind of reddish, whereas a laser will only emit a wavelength of, say, 630 exactly, and nothing else. Okay, and that's one of the foundational sort of definitions of a laser, that it's monochromatic or single wavelength. The other thing about lasers is that they're focused in these beams. Basically, it's like a laser beam, and light is actually not focused, it's scattered. Okay, and what the upshot of all that means is that essentially, because of the focused nature of the laser and because of the specific wavelength that is associated with each individual laser, lasers can deliver more targeted treatments in general than light sources. Okay, they each have a very important role to play, but they're different in important ways. And we often combine our lasers and our lights together so that we can leverage kind of the advantages of both and therefore achieve some better results than either one alone can do so. Um, and this is basically an illustration of the principle behind which laser works. So chromophores are basically molecules in the skin that can be targeted by laser. Okay, so maybe it's like pigment, for example, melanin or blood vessels or something like that, just any target in the skin. And what we do is we select a laser that has a specific wavelength that gets absorbed by that target. Okay, because every target kind of absorbs a special wavelength, essentially. And as long as we can deliver enough energy using that laser and this specific wavelength into the target, then we can kind of change that target basically through heat. Okay. And therefore cause a change in the skin that we want to see. So reducing redness, or maybe getting rid of brown spots, or whatever it may be. And as long as we can confine that energy with the laser just to the target, then it becomes a really safe and really effective way to sort of conduct laser surgery. And this is a theory that was developed, 40 years ago, but it's still the principle upon which most of laser works today. And it was a really breakthrough sort of discovery, back in the day. So how do we classify lasers? There's a lot of ways to classify lasers, but I think the simplest way is basically on what they do. Okay, so very simply put, we can say that there are vascular lasers, okay, and these are lasers that essentially have wavelengths that target redness in blood vessels, okay. There are pigment lasers, okay, and these target brown spots, okay, or any sort of unwanted pigmentation in the skin. And then there are hair removal lasers, okay. These are usually the ones that are used to get rid of hair by targeting the hair follicle. And then finally, as a broad catch-all, there are so-called resurfacing lasers, and these are the ones that kind of generally stimulate collagen or remodel the skin in certain ways in order to improve overall skin quality. And this is a somewhat simplistic way to look at it, but I think it's useful because it's practical to look at it this way. And there's overlap between all of these lasers. Many can do, multiple different things. But it's useful to think of it this way because it also kind of gives rise to most of the common concerns that we face. So, for example, the V-beam, okay, uh, anyone who's been to our office or any laser office has probably encountered or maybe seen this type of laser before. V-beam is what we call a pulse dye laser, and it has a wavelength that is very special for redness and for blood vessels, basically. And it essentially is one of the most popular lasers in the world currently for the treatment of any sort of red condition of the skin. It was first developed back in the late 1980s and has gone through 5 or 6 generations of development to this point. And in fact, a new one is waiting in the wings, hopefully maybe by the end of this year or into the next. But a very versatile laser and kind of a cornerstone of many laser practices. You can see this gentleman here had some broken blood vessels to his cheeks, and after a couple of treatments, actually I think just this fellow, I think, just had one treatment. You can see some fairly significant improvements. This patient, came to me for brown spots and overall anti-aging concerns, but the other category of laser we have is so-called pigment laser, and there's many different types of pigment laser. In this particular case, it was the pico way that was used, but there are lasers called the Alexandrite laser, the ruby laser. There's other pico lasers like PicoSure and etc. There's quite a long list, and we have most of them here. And it's not that they're redundant. Each of these pigment lasers has slightly different quality to them. And so by having them all, we can kind of fine tune each individual patient that comes into our office. We can kind of select the one device that hopefully is going to be the best for that individual patient. So it does help to have a plethora of options. Now, resurfacing lasers, we can kind of further subdivide into what we call non-ablative lasers and ablative lasers. Basically, what that means is that there's the non-ablative stuff, which is kind of medium strength or gentle, and then there's the ablative stuff, which is really strong. Ablative basically means that the laser is so hot and so strong that it essentially instantly vaporizes the little bit of microscopic targeted skin. Okay, and that in turn produces a very powerful healing response that results in a lot of new collagen formation and just a restructuring and remodeling of the skin. We've pioneered a procedure, a blended laser procedure here at our practice called the Take 10. And the core of the Take 10 procedure is two powerful ablative lasers, one called a CO2 and one called an erbium YAG. And it's only via this type of power that we can achieve truly, transformative change. The flip side to that, of course, is that the downtime is a little bit more, the risk is a little bit more, and there are some special criteria that need to be fulfilled in order to be a good candidate for such a procedure. But this is an area of laser dermatology that can be very useful, and it's increasingly becoming less and less common because the training for it is long and experience required to operate safely is high. But still, it's a very useful tool to have, and it's one of our most popular procedures. On the non-ablative side, this basically includes everything else. Okay, so common things are like Fraxel, Clear and Brilliant, and essentially all the other fractional lasers that we have in the clinic. And these are really good too because they're actually more popular. You have less downtime, you just kind of sunburn afterwards, and you maybe need to do a few more treatments to get to the goal, but that's a worthwhile trade-off if you can continue to live your life without hiding out for a week or two. So this is kind of an example. On one hand, we have the non-ablative treatment where this individual was able to get some improvements in acne scars and some discoloration and just get sort of a glass skin-like appearance, which is kind of a hallmark of this type of laser when it's done correctly. And you can also notice that this individual is not necessarily super old, and original skin quality is not poor in any way, other than maybe a little bit of acne scar and discoloration. So this type of situation is really good with the non-ablative option. On the other hand, the individual with the ablative treatment has maybe a bit more advanced sort of sun damage and photo aging essentially over time. So deeper wrinkles and a little bit more textural issues, etc. And so the ablative laser path is going to be really useful for the situation. And you can see how a lot of the deeper folds and wrinkles have just really improved a lot. And overall, the skin has really, taken a good turn for the better. That does, of course, like I said, come with a little bit of a price in terms of the downtime and the recovery period. But as long as that's monitored properly, and we have a very detailed protocol to follow during this recovery period, it can be an excellent option. And the results are very long lasting. This is kind of a once in 5 to 10 year type procedure. So moving on from lasers and lights, we move to a different sort of energy category, what we call radiofrequency and ultrasound. So these non-light based energies. And these have a really big role to play, especially in so-called skin tightening. Okay, it's probably one of the most common concerns that we all face eventually with time and age and genetics, is that our skin starts to lose a little bit of its elasticity, starts to lose a little bit of its structure, and therefore we get the impression that it's getting a little bit looser or sort of falling downwards. And it's very common for patients to come into the office and just kind of go like, well, can't we just pull the skin up a little bit like this? Wouldn't that be nice? And we probably all do that in the mirror a little bit sometimes. So this is where radio frequencies and ultrasounds can really come in handy. And again, we have actually a really good selection of technologies dating back, to be honest, a good 20 years of journey through this space. There are things like thermage, which was introduced over 20 years ago, and we have the latest version of that. Subsequent to that, there have been ultrasounds like therapy, and then the newest version called soft wave. All of these are excellent for skin tightening purposes. And then radio frequency can also be delivered via microneedles. Okay, which is an interesting thing to do. So, what is radio frequency? Well, very briefly, it's basically a way to harness electrical energies to generate heat within the skin. So when RF energy is applied, it causes essentially electrons moving sort of back and forth, but there's a resistance to that movement in the skin, and when that resistance happens, it becomes heat. And if we can control and tune that heat appropriately, then we can basically achieve similar sort of things that lasers can achieve with the heat, but in a different and sometimes safer way, especially for maybe pigmented skin types, for example. This type of technology can be super, super useful. And the two ways that it can be delivered is kind of the traditional non-fractional way, which is like thermage, where you kind of just have this tip on the device and it contacts the skin and essentially just delivers a bulk heat. Okay, so the entire portion of skin gets heated to in a very controlled way to a very precise temperature, and that's the temperature at which collagen can be stimulated and produced. And so this kind of illustrates a little bit how you get this kind of controlled heating over a fairly broad area within the skin. On the other hand, you can kind of deliver it with microneedles, okay, where this is also an energy device, basically, where you have these little tips that have many microscopic little needles, and the needles kind of insert into the skin, but at the tip of each needle, there's a little bit of a radio frequency probe that releases energy and kind of heats up the specific depth of skin that we're targeting with the needle, and that's always adjustable. Um, and so that way we can kind of deliver the energy in a more focused way, as opposed to just heating up all the skin. We can now target certain layers of the skin and just heat those. And so it can be a really nice way to go to increase the effectiveness of the procedure as well as increase the safety. Um, and then there's ultrasounds, and these are really cool because when we think about ultrasound, we first think about, well, imaging, right? Because that's the main use for ultrasound. But it turns out that if you use ultrasound and you kind of focus the ultrasound energy into points in space, then you can actually, again, generate heat from the ultrasound. And this was one of the technologies that was very first to leverage it, called therapy, where we can visualize the tissue in real time with the ultrasound capability, and therefore know exactly what layer of skin that we're delivering the energy into. And so the beams get focused in this layer and causes these little areas to be heated to the point where new collagen gets produced. Okay. And that's essentially exactly how it looks like in real life. And then the next generation of that has basically tuned the ultrasound energy so that it can be a little bit broader and it can maybe cover a little bit more area per pulse. So therefore maybe give a little bit of increased effectiveness for skin tightening, especially in that's called soft wave. It's been a very popular treatment, truly, because it's, although all of these treatments are a little bit painful, soft wave sometimes is a little bit more tolerable than some of the older generation technologies. And patients have been really happy with the tightening effect and the lifting effect. With the caveat, of course, that non-invasive skin tightening, so non-surgical skin tightening, is still a bit of a challenge for us as dermatologists. So it's not like we get facelifts just by shooting energy into the skin, but still we can get some nice noticeable improvements that people are generally quite happy with. So basically, to summarize, there's a lot of just marvelous technologies that are being developed and have been developed and will continue to be developed in this field. And the pace at which these developments happen is really only accelerating. There are a couple new things that are coming on in the horizon that we have an active clinical trials department at our practice, and anyone who wants to participate in that is welcome to contact us. There we test and trial many of the new technologies that are eventually going to come to market. But ultimately, having all the tools is of course important, and having high quality tools is important. But the most important thing is really understanding how to use them individually for one, but in combination. That's really where the magic happens, is when we can combine all of these different technologies in sort of a blended way that works very well and kind of synergizes. And that's kind of where the magic is. That's kind of, I guess, be the next talk. But for now, that's kind of the overview. Hope that wasn't too long or dry, but thank you so much for tuning in.
Thank you so much, Dr. Wu. That was great. You'll see me. Um, I'm sorry for anyone that's there was some weird things happening with some of the animations on the slide that I know one of you saw. But don't worry, we'll do our best to get it fixed in post before we send out the recording. But otherwise, thank you so much. That was great. And we already have a lot of questions in. So guys, at this point, this is your time to go in and ask any questions you might have while we have Dr. Wu here. All right. So let's get into this. Let's see. We have how how do you recommend treating large pores on the nose?
Yeah, very common problem. And in general, pore size is quite difficult to alter. However, there are some reliable ways to do so. The first thing to sort of make the decision is the baseline skin type that we're treating, because things like CO2 laser are probably the most effective methods for reducing pore size. And CO2, if you recall, is kind of the powerful ablative laser in the resurfacing category. However, darker skin tones are a little bit too sensitive to use such a high-powered laser because there's a little bit of additional risk. And so in fair-skinned individuals, in large pore size on the nose, I would say CO2 hands down is one of the best options. But for skin of color, then we may use CO2 still, okay, and just accept that there's going to be a little bit of increased risk for somewhat prolonged, maybe hyperpigmentation or darkening of the skin afterwards that may take quite a while to fade away. But more often than not, we tend to use non-ablative lasers, things like Fraxel and or microneedling, or even the fractional picosecond lasers can be quite good for pore size reduction. And beyond energy devices, there are things like chemical peels that can be also helpful. And then finally, simple skincare. Evidence-based skincare, things like retinols have been shown to help with pore size. Growth factor serums have been shown, the right ones anyways, have been shown to help with pore size. So generally speaking, we have to kind of find that good combination for each case and each patient, but those are the options.
Got it. That makes sense. All right. So what treatment do you recommend for acne scars? Ablative lasers or RF microneedling?
Yeah, technically, ablative laser is going to usually give the best result if you compare treatment per treatment. And we've done some studies to try and quantify that, and a very rough estimate is like one ablative laser treatment is roughly equivalent to like three non-ablative laser treatments or so. And that's just a very rough guide. But in individuals who can accept the downtime and who have the appropriate skin type, then I think ablative laser is certainly in the conversation as one of the good options. Okay. However, for skin of color, then it's a little bit more of a nuanced discussion. Again, there's a little bit of additional risk. And in those situations, RF microneedling can be actually a really powerful tool because the risk is so much lower and you still can achieve some nice results, especially with some of the newer RF microneedling technologies. One in particular that we have now is called Potenza, and it has this special ability to kind of infuse the skin with active, ingredients that we think are going to help the skin. We can do it at the same time as the needling procedure, and so you kind of get a double sort of effect where we're infusing the skin with healing or growth factor type products, and then we're also getting the microneedling effect. So that's a useful one for skin of color.
That's helpful. So IPL for rosacea you talked about, is that a permanent treatment or does it require ongoing treatments?
Yeah, rosacea unfortunately is considered a chronic sort of condition whereby we don't necessarily always cure it, but we hopefully can control it. And so the short answer is usually we would expect to do some form of maintenance after a series of IPL treatments. And as a rough guide, on average, 3 treatments or so of the IPL spaced about 1 month apart for most cases of rosacea will produce some pleasing result. And then after that, my patients tend to come back maybe once a year or twice a year to get things touched up with another IPL treatment.
That makes sense. And actually, one person just posted a little testimonial. He said, I have rosacea, and though there's no cure, um, let's see some details. And then he said the V-beam laser he had by Dr. Groff was amazing. And he's asking, for the V-beam laser, also, how often do you recommend it? Maybe annually?
Yeah,
And
I
how
think
close is medical science to a cure?
yeah, yeah. The V-beam and IPL are two that are we most commonly use for rosacea and redness. Yeah, twice yearly or yearly is very reasonable with that laser. And in fact, they can be used together as well to get even added effect.
Yes. All right. How about any lasers to treat the lines on the upper lip?
Yes. So upper lip lines, again, super common problem. The most effective laser anyways, to treat that issue is going to be an ablative laser. And the CO2 is actually really great at that. However, there's additional risk in this area with the CO2 laser is that sometimes it can lighten the skin a little bit, okay, and kind of change the skin tone as compared to the surrounding skin. And that's not usually a desirable sort of result. But it is very effective at reducing the wrinkles. Um, Other non-laser ways to reduce the wrinkles would be like simple injections, for example, because sometimes the wrinkles are caused by volume loss. And so we can inject a little bit of volume replacement to sort the issue. And then sometimes it's caused by muscle motion or hyperactive, like lip muscle, essentially. And a
Mm,
drop of Botox can be helpful. So there's some options in that regard for that problem.
okay. Can the more gentle procedures, such as an IPL, be used on people with sensitive skin?
Yes, definitely. Now, it sensitive skin, like for example, many patients with rosacea have very sensitive skin, and generally speaking, skin sensitivity doesn't really correlate to laser tolerability. Um, so you could be very sensitive to products and topical compounds or environmental allergens or whatever it may be, but that doesn't generally dictate how you would respond to a laser. It's more your skin type, and by that I mean, the pigment content of the skin. Um, that's kind of what mostly governs how you would respond to laser.
Okay. Here's a great question for you. I have dark, tanned Asian skin. Pigmented skin like mine is typically very difficult to treat. And now that I'm in my 50s, I would like to do more rejuvenation, but what is safe for me? I have a lot of dark spots and many wrinkles around the eyes. How do you even treat areas around the eyes?
Yeah. So this is something that has become a specialty of ours. As you know, it's a very common scenario, and we've developed some special ways to approach it. But first of all, if you have an active tan, um, then it's recommended to wait until that stabilizes and or fades a bit before doing any sort of laser, because actively tanned skin is just much more sensitive to laser. And by active tan, I mean like you just had your tan is like a few days old or something like that. But if it's stable and it's just your baseline skin tone is a little bit darker, that's what we would kind of call skin of color. And to approach that, lately, one of the best technologies has been so-called picosecond laser. It's a special category of laser that has a technology that basically makes it safer and better in most cases for pigmentation and skin of color. So as a very generalized statement, that might be a very good option for you. It's a bit tricky to use, and there are some precautions that need to be taken, but if used correctly, it can be a really great option for skin of color, exactly as you've described with sunspots and accumulated sun damage over the years.
Got it. Okay, so many good questions are coming in, you guys. We're going to try and get to as many as we can. Okay, let's talk about melasma, another tough area. So, which laser is best for melasma, and how many treatments will I need to remove it?
Yeah, melasma is a tricky one because it's known to rebound or get worse in response to laser. And so we generally don't consider laser therapy alone to be appropriate for melasma. We always have to combine laser therapy with an appropriate sun protection regimen, as well as an appropriate sort of topical pigment controlling regimen as well. And in that scenario, if we've kind of laid that appropriate foundation, then there are some lasers that can be really useful for the treatment of melasma. For example, something called the clear and brilliant laser. It's a nice, gentle laser. It's actually a very small, simple device, but it can be really useful for melasma because the risk of triggering a rebound reaction is pretty low with that laser. And with consistent treatment, we can get really consistent improvement in melasma using that option. The picosecond laser is also a very good option for melasma, and I very often combine the two together, the clear and brilliant and the pico. And if you go on our website, you can see examples of this type of work. But that's generally speaking two of the really good lasers for melasma. But again, it's never appropriate to treat melasma only with laser. It always has to be combined with creams and sun protection in order to maximize the effect and make it as safe as possible.
That makes sense. So Potenza, I haven't heard of that before. Can you tell us a bit more, and give us any idea on pricing?
Yeah, Potenza is a microneedling device with radiofrequency, um, and it's one of the newer ones. It's been out in the market for a couple of years now. The unique thing about the Potenza is that the settings are highly adjustable, which is a bit of a departure from previous generation of microneedling technologies where you could, adjust a few of the settings, but mostly it was kind of locked in, and you could only, use, high, medium, or low, or something like that. Um, but with the Potenza, you can really fine tune a lot of parameters, and I found that that has been very helpful because when you really get down to it, everyone's skin is slightly different, and almost no two people are truly like the same. And being able to adjust slightly in favor of one person or the other, that's actually really useful, I think. And so the Potenza was able to do that, and that's been very, very helpful. And as I mentioned, it also has that ability to infuse the skin with a special tip technology that it has. So that's one that I've been using a lot in recent years. A very versatile device. Pricing is really dependent on what we're trying to treat. It depends on the surface area that we're treating, the condition that we're treating, and any sort of additional things that we're doing in terms of infusion and or different tip types and stuff like that. So hard to really narrow down a price, but I would say as a very broad range, it probably is. The range is somewhere in the range of 500 to 2,000 or so for this type of treatment.
Thank you for sharing that. Um, so let's see, someone else was asking about like price range estimates for all the different lasers you've been talking about. Is that kind of an average range of kind of all of them, or?
Except the very powerful tape 10 type lasers.
Mhm.
That regimen is a bit pricier, um, just because it's a much, much more involved procedure. And we put a lot more work into it, and there's a lot more follow up involved. And the goal of that procedure is a little bit more radical in nature. But in general, yes, for the rest of the lasers, that fairly broad range is roughly how it goes. Radio frequencies and ultrasounds are, a bit of a different category as well. But yes, that's a rough guideline.
Okay. Got it. So is age a factor? I'm 70 years old. Is 70 years old of age with pretty good skin too old to attempt ablation?
Interestingly, unlike the rest of the organs in the body, age doesn't really make our skin less able to heal. And in some ways, aged skin is better at healing than really young skin. Um, and so actually, it's not the age that matters in terms of undergoing ablative laser procedure. It's more uh, factors like downtime and lifestyle, and then potentially underlying medical conditions, things of that nature that we look at. But age itself is actually not a factor at all. 70 is totally fine. We've resurfaced individuals into their 90s and beyond, to be honest. So um, that's not an issue usually at all.
All right. Are there any treatments for removing precancerous rough patches on the skin? Any alternatives to just getting zapped at the derm or using Effudex?
Yeah, that's a really interesting and topical question at this point, because you're right. Most of the time, you go to the derm and you get zapped with liquid nitrogen, and it kind of works, but sometimes leave some white spots behind, etc. Or you do Effudex and your face is on fire, or your arms, or wherever you're putting it, it's on fire for like 3 weeks, and it's very unpleasant. It turns out that there's actually the non-ablative fractional laser class. Recently, some very good evidence has shown that over time, consistent usage of these class of devices to treat the skin has a preventative effect against the development of um, common skin cancers, like those that derive from actinic keratosis, for example. Um, and so that was a very interesting finding. We always kind of suspected that, but it just took time to get enough evidence to really show that. That being said, I still wouldn't label laser as the first line therapy for any skin cancer. Um, However, it's nice to know that although we primarily use them for cosmetic purposes, we're also helping our skin in terms of its overall health as well when we undergo this type of procedure.
How about any treatments for lessening surgical scars or keloids?
Yeah, all the fractional lasers have the ability to lessen scars and to revise scars. The current most effective way to do so is with, again, a powerful fractional CO2 in combination with some injection, and usually with another laser, the V-beam, for example, in the right situation. That kind of blended approach is thought to be kind of the best way. Scars are stubborn, and so there's no real shortcut. It does take multiple treatments. It is a bit of a journey. It can, and it almost always is frustrating. At some point during that journey. But if we stick to the rules and do the right thing in the right way, at the right time, it usually ends up really, really good, actually. So it's very worthwhile.
Got it. All right. All right, guys, we'll get through a few more. So how about a laser treatment for spots on a bald head?
Yeah. We actually published this, the first publication on this, even though it's a very common problem. Turns out the Fraxel laser and lasers like Fraxel can be applied very safely to a scalp, and the results are phenomenal. It just kind of resurfaces the area. It's not, generally speaking, a very sensitive or painful area to treat. So we put some topical numbing on there, have some cold air blown, and usually it's quite tolerable. And then, yeah, within 1 to 3 treatments, it usually works out really well. So that's something that we can now treat.
That is amazing. Let's all spread the word, guys. We all know people that probably have questions. All right. Here's another one. My son got his cheek cut open when he was 10 with 26 stitches on the cheek and under the eye. Is there an age you recommend being more optimal for scar revision?
Yeah, in general, the age doesn't objectively, influence the outcome of treatment. It's more so, if possible, treating early as opposed to waiting. That's now been established as the better way to go. In the past, actually, many individuals and docs would recommend waiting until the scar kind of like matures before treating it. But now we know if you treat it earlier, then it's actually better. The practical consideration, though, is that these treatments aren't necessarily like comfortable, and so for certain age categories of kids, it's very hard to convince them and or have them tolerate this type of procedure. It's a bit scary, honestly, and it's somewhat painful and stuff like that. So that's more of a practical consideration in terms of when to treat. Um, and it just requires some communication and just, some informed decision making.
All right. Let's see. Oh, here is a great one. So, is there any options to treat rough old hands?
Yeah, hands are super important. Um, and in fact, all of the lasers that we use on the face, except maybe the strongest, the ablative lasers, can be appropriate for the hands. Um, and we just have to respect the fact that the skin of the hand is very different than the skin of the face. And so we have to tune our laser settings in order to respect that. Um, in general, the further off the face that we go, the slower or less capable is kind of the skin healing response. Um, but as long as we are aware of that and have the experience to accommodate for that, then we can adjust our laser settings and treat hands very safely with almost all of the lasers that we have.
All right. Can lasers be used for sun damaged spots on the legs and arms?
Yes, again, a similar sort of considerations for with the hands, but yes, we treat the arms and legs all the time, and I suspect that if you go on our website, you'll see some of those images as well. But IPL, for example, is excellent for that. But any laser really, it really depends on what we're trying to treat, and that's the more important question.
Yes, I will try and post a link for that. So, can a 17-year-old get an acne scar removed by laser?
Yeah, again, it's personal choice. And as a 17-year-old, it's prudent, I think, to maybe have a wider conversation with maybe the parent or guardian or etc. But medically speaking, there's no reason not to. The skin is going to respond just as well as any other age category skin, and so that would be more of a personal choice.
Understood. All right. Let's see. Okay, few more. What is the most effective laser for the perioral area where you can still sleep on your side?
So I don't quite understand. So as in a treatment that isn't going to totally like destroy the area and make it so that you can't like touch it.
I guess
That is
I'm
that.
not 100%
Uh,
sure either. Maybe
yeah,
whoever wrote that, if you want to clarify again, you
I
can
think
go
yeah,
ahead.
because if you sleep on your side, then you're going to rub the area that gets treated, and that would be bad if you're doing like a really strong laser, like an ablative laser. Um, so if that's the question, then I think a strongly tuned medium strength laser might be a good way to go, or something like a radiofrequency microneedling, maybe even in combination with some ultrasound, um, can be good options as well, or injectable treatment. If wrinkling is the main concern, then sometimes injections can be really helpful too.
Got it. All right. Does using radio frequency RF technology on the face cause any loss of skin plumpness or volume?
That's a very common fear, and theoretically, it is possible. If the needle goes to the depth of the fat layer, then, and if it delivers enough heat into that layer to cause loss of fat, then theoretically it's possible. And so that's why, as a blanket, foundational statement, any of the technologies that we use, they have to be used with respect and caution, because they can all cause unwanted side effects. But if used correctly, then the RF microneedling would not cause that type of loss of volume. And we usually never want to lose volume in our faces. So we try to be very cognizant of that.
Right. So you mentioned that IPL is not the best for ethnic skin. Can you clarify why and remind us all what is best for skin of color?
Yeah, IPL can be used for ethnic skin, but the issue is that it requires special filters that basically filter out wavelengths of light that might be a little bit too aggressive for darker skin tones. And in general, when we use IPL for darker skin tones, we have to kind of scale back the treatment level a little bit, in terms of the energy and power and stuff like that, in order to ensure safety. And by doing so, we might detract from some of its effectiveness. Um, and so, my personal preference, if given a choice, is to, usually use a more targeted laser in skin of color versus an IPL. And that's a very general statement because I do use IPL in skin of color actually all the time. And it certainly has its place and can be used. Again, it comes down to just how it's tuned and how it's used. But that's the reason why IPL is a little bit more dangerous for skin of color, because it's not quite as selective or targeted or focused as a laser can be.
Understood. All right. Lasers that can be used on the under eye area.
Yeah, under eye area responds usually very well to ablative laser, in the right situation. But almost any laser can be used under the eye. But anytime we do any sort of laser or energy-based treatment around the eye, we always have to be, of course, very cautious of preserving the eye health itself. And if needed, then we insert a little contact lens. It's like a little metal shield that protects the eye from all of the treatment. And it sounds a little bit invasive and awkward, but it's a very common technique, and we can do it very elegantly and comfortably. So that's a really good safety measure to have on board.
Absolutely. It looks a little crazy, but it is great. All right. So how about skin tightening? Are any lasers that can help tighten skin, like your gels or loose skin under your chin?
Yeah, actually, every laser technically has some tightening ability, and because the heat causes a bit of contraction, um, and tightening of the collagen as it gets produced and developed. So technically, any of the lasers that we mentioned have some tightening ability, but practically speaking, I would say the stronger the laser, the greater will be the actual tightening effect. Um, and we've actually done studies where CO2 laser, and the funny thing about CO2 laser is that when you fire it at the skin, you can see an immediate contraction response. So there's an immediate tightening that is visible. It's not persistent, but a percentage of it remains even long term. So CO2 is probably the best tightening laser, if you will. It's not the first choice for skin tightening in general, just because there's downtime and risk, and etc. But if we're just talking about laser, then that's probably one of the more effective skin tightening lasers.
Got it. All right. Oh my gosh, we have made it through so many questions. There's still a couple left, but we have to stop at some point. So I appreciate all of you guys so much for asking all your questions and for staying with us and spending your time with us this evening. And mostly Dr. Wu, thank you. I know you had a busy day seeing patients and we just threw like how many 30 different questions at you, like rapid
It's my
fire.
pleasure.
So we
Thank you.
appreciate you giving us your time. And people are saying thank you, very informative. Thank you, Susan. Thank you, Laura, for the kind words, but really thank you. We will be working on preparing the recording of this and we'll send it out. I know there was a lot of information, but you can watch again. And most importantly, we would love to see you in the practice because all of these answers are best if we can see your face and see what we're talking about to help treat you. We have more than 60 lasers and devices at Cosmetic Laser Dermatology. So Dr. Wu went over a bunch of them today, but if you're interested in laser, there's really no better place to come because we own them all. We have them all on site. And so we can figure out which one's the best for you, which is so different. So many other practices only have a couple. So they'll kind of try and fit you into what they have versus at our practice, we really fit you into what you need. So thank you so much for your time, everyone, and for Dr. Wu. We really hope to see you in the practice. You can book online right now at our website, clderm.com. Oh, Anita says Dr. Wu is the best. Thank you. So please book online to see Dr. Wu or any of our amazing physicians. Make sure you follow us and Dr. Wu on social media. And we hope to see you all in the practice soon and enjoy the rest of your summer. Thank you so much.
Bye. Thank you.